Now for the introduction to Dr. Lee Fang Jann. Dr. Lee is a urologist and renal transplant surgeon with a specialty focus on men's health, male subfertility, minimally invasive kidney, and prostate surgeries. With over 20 years of medical experience, I believe it's now time to pass the mic over to Dr. Lee for him to share with us more about what he's been so passionate about. Dr. Lee Fang Jann, please.
Thank you, Shanlin. I'll be sharing my screen. Okay, welcome everybody. It's a pleasure to have you join us or join me today, this evening for a talk. We'll be talking about men's health for the next 20 minutes or so. All right. I'm Dr. Lee Fang Jann. I'm a urologist. I'm medical director of UroDoc. These are my credentials. I'm a adjunct assistant professor at NUS Medical School, current sitting president of International College of Surgeons Singapore, and vice president of Asian Association of Andrology. I'm a VC with the Singapore General Hospital and NUH, a former director when I was NUH of the andrology, as well as the male subfertility program and the surgical director of the transplant program. All right. The outline of the talk today will be, I'll be running through some common urological conditions, and we will cone down on prostate cancer and a slight brief on in terms of medical insurance claims, how to go about helping with the management of costs for treatment of some of these urological conditions. All right. So what is urology? Urology is a branch of medicine that deals with the urinary tract. This is the urinary tract, is the system that actually helps to treat waste product and pass off excess water produced as urine in the urinary system. It consists of the kidneys, the ureters, the bladder, as well as the urethra. And some of the common conditions affecting the urinary tract may include urological cancers, of course. Okay, so involving the kidneys. Kidney cancers typically are, in our current practice, typically pick up on routine screening, whereby you see a mass within the kidney. Bladder cancers, cancers in the urinary bladder, whereby a lot of times the presentation will be that of painless bleeding in the urine. Or one of the focus of the talk today will be cancers within the prostate in males. All right. Other things that urology field or urologists treat will be that of urinary stones. Urinary stones are little occurs within the urinary tract when typically with dehydrations and a lot of crystallization occurs within the urinary tract, and when they clump together, they form little sediments or stones. While within the kidney, usually there are no symptoms, okay? But if they do decide to pass out through the urinary tract and actually get lodged within the ureters per se, that's when we see a lot of patients presenting acutely to the emergency department for treatment, because it is one of the most painful conditions that anybody can experience. All right. Other things that the urology do, and one of my subspecialty focus will be that of kidney transplant. Kidney transplant is a procedure whereby in patients with kidney disease to the state whereby they develop end-stage renal failure or kidney failure, whereby they require, in order to sustain life, they require some form of renal replacement program, be it hemodialysis or peritoneal dialysis. Kidney transplant is a form of treatment that actually provides them with a better quality of life. Other conditions that urologists treat will be that pertaining to urinary incontinence as well as infection. Okay, evaluating patients with these conditions and to help solve this quality of life issues. All right. Urology, in the field of urology, we don't just treat the urinary tract within involving the male as well as the female. In the male group of population, we also deal with the male reproductive tract. Okay, in the male reproductive tract, this consists of the testis, scrotum, the prostate, as well as the penis, and this is the tract that is involved in the production, storage, as well as the transport of semen for reproduction. Okay, the conditions that affect the male reproductive tract includes conditions such as erectile dysfunction in males, whereby, or simply put as impotence, whereby there is problem maintaining rigidity or hardness of the penis adequate for sexual penetration. Other common sexual-related conditions also include premature ejaculation. These are conditions whereby in an embarrassing state, whereby a man actually ejaculates before he plans to. All right, too early. All right. Other things in terms of treatment, the other thing that I focus quite a fair bit on my practice on will be male infertility issues. These are conditions whereby a couple having been trying to conceive a child for an extended period of time, they find that they're having problem, and during evaluation, they found that actually the male partner actually have issues in terms of the quality or quantity of sperm within the semen, and that's when they see a urologist for treatment. All right. Testosterone deficiency syndrome, again, a very common syndrome afflicting men as they get older. As the man gets older, occasionally this condition occurs whereby the testosterone depletes to such a level whereby it's affecting their quality of life. Okay, when the testosterone level gets too low, it affects a male's general sex drive, vitality. They get more tired easily. It affects the erectile function. Okay, you find that they have decrease in muscle mass, increasing visceral body fat. They kind of seem to shed off excess weight. There's testicular atrophy. They develop osteoporosis, osteopenia, wasting of the bone, and loss, in very severe cases, a loss of facial axillary pubic hair. So what the urologists do, you can see we cover quite a broad field of practice. Okay, we are not just surgeons that remove cancerous lesions within the urinary tract or stones. We also are physicians, okay, that treat medical conditions affecting the urinary system, improving quality of life. And that's why I love the field, and that's why I'm a urologist, okay? So diving down and diving into what we want to discuss further today will be that of prostate health, okay? What is a prostate? A prostate gland is actually a male organ that is located, its walnut size is located at the base of the bladder, okay, through which urine actually flows through, okay, connecting it to the penis, all right. So you notice that within the prostate gland, it's just not one tract, there is an additional tract. This is a confluence of the urinary system together with the male reproductive system. You can see that, okay, through this other tract is where the semen that's produced by the testis actually flows through the ejaculatory duct, stored in the seminal vesicles, and actually flows out through the common conduit of the urethra, okay? The main function of prostate is to provide some of the volume within the semen, okay, and this functions to nourish and protect the sperm contents, okay. The signs that you actually have a prostate condition, okay, you can look at it. It is mostly urinary in nature, okay. Even though the fact that, the prostate gland, it is a male reproductive gland, because, in a daily basis, most of our functions are urinary in nature. Okay, you find that if anything, okay, if there's any problem with the prostate, it is likely to affect our urinary function more. Okay, so things like incomplete sensation that you cannot completely empty your bladder, things like waking up multiple times at night to pass urine, weakness or intermittency within the urinary stream when you pass urine. You can notice blood in the urine, for instance, or you have a constant urge to urinate. All right. And what are conditions that can affect the prostate? This is one of the most common conditions. Okay, prostate enlargement, or BPH, which is short for benign prostate hyperplasia. Okay, unavoidable conditions as we get older. Okay, so the prostate gland actually enlarges and increases in size, and as the prostate gland enlarges, you can see it has implication on the lumen. Okay, the caliber of the urinary system is akin to a tap turning off a tap. Okay, so as we get older, you can see a lot of older men, they start developing problem with slowing down urination, dribbling of urination, or having problem emptying the bladder. Okay, so why I say it's unavoidable. Okay, you can see from this chart. Okay, this problem typically manifests itself from the age of the 40s, and it actually increases pretty linearly, okay, till it hits about 90% of the population by the time they are 80. So most men, okay, who comes to see me, if they are of a certain age, chances more likely than not, they are seeing me for a prostate enlargement problem, right? The other big common conditions that affects the prostate, but definitely more dangerous will be that of prostate cancer. Okay, how common is prostate cancer? Okay, in the latest Singapore Cancer Registry from 2014 to 2018, prostate cancer has climbed from 3rd place to 2nd place. It's getting more common. Okay, behind colorectal cancer, prostate has overtaken lung cancer as 2nd place. So it is so common that throughout a man's lifetime, okay, or any man, 1 in 8 men will develop prostate cancer, okay, in the lifetime, right? The stages of prostate cancer, obviously, as the prostate cancer develops, we always start with a stage 1 prostate cancer, whereby the cancer is actually confined to within the prostate, and as it progresses, it becomes a stage 2A, T2A, T2B, and T2C, for instance. And when it grows to a certain size, it actually invades outside the prostate and invade the surrounding organs, be the seminal vesicles or even the bladder. Okay, and the late stage, or the stage 4 disease, this is when it actually breaks off and actually spread to other parts of the body, be it the bones, the lymphatics, the lungs per se. Okay, and what are symptoms of prostate cancer? Okay, you can see that the symptoms are pretty similar to prostate enlargement. Okay, it can interrupt the urinary stream, making them weak, or you can have sudden urge to urination, for instance. There's trouble starting urination or emptying the bladder completely. It may be painful to urinate. Okay, when the prostate cancer has invaded into the lumen or lining, it can cause bleeding, so you can have blood in the urine or even the semen. At a very late stage, whereby it has spread, it's broken off and spread to the bone, for instance, you can have back pain or bone pain in the hips or pelvis. When it spread to the lungs, then you can become breathless, or you get tired easily, or if it invades the bone marrow, you get very anemic, you get dizziness, for instance. Okay. But what I want to draw your attention to is that, early prostate cancer actually has no symptoms. Okay. Why do I say that? You can see that based on the symptom per se, those symptoms manifest as the cancer actually enlarges, okay, to a size whereby they impinge on the urinary lining or lumen. Hence, very similar symptoms to prostate enlargement. But as you know, all conditions, okay, be it cancer or any other medical conditions, the best time to treat it and the easiest time to treat it is actually when it is at an early stage, okay, as early as possible to give it the best chance of treatment. So having said that, okay, what is the risk factor of prostate cancer? How do I know, or how you know that you are at risk? Okay, again, age plays an important role. Okay, so men, typically when we see prostate cancer, these are in men that's over the age of 50. Okay, in terms of ethnicity, okay, we are in luck. Okay, so the most commonly ethnicity that actually afflicted by prostate cancer are those of African Caribbean or African descent. This is followed by Caucasian population. So typically in the Western population, prostate cancer is number one cancer. Okay, not colorectal cancer like here in Asia. Okay, so African American followed by Caucasian, then it comes Asians. All right. And if you have family history of prostate cancer in the first degree relative, be it a brother or your father has prostate cancer, then your risk of prostate cancer actually doubles. All right. So these are the common risk factors that we look out for. Okay. And you have a concern, if you are worried, okay, that whether you have prostate cancer, okay, what do we do when you actually see a doctor? In order to diagnose it, usually the first step is actually running a blood test called a PSA test, or prostate specific antigen. So a prostate cancer, prostate conditions is unique in the sense that you actually have a blood marker that can pick up any abnormality or conditions, okay, easily through a simple blood test. So when it's elevated, okay, then then we becomes a little bit more concerned and want to evaluate further. Okay, this is complemented by through the physical examination. Okay, because prostate gland is actually pretty deep. Okay, through a general external examination, we can't access the prostate well. So usually, to access the prostate, we need to undergo something called a digital rectal examination, whereby the doctor actually insert a glove finger through the anus into the rectum, and what they are actually feeling for is through the wall of the rectal mucosa. We are feeling for the size of the prostate gland, feeling for the surface, whether there's any nodularity or irregularity to suggest, okay, there's maybe a underlying or suspicious lesion like a cancer. All right. Okay, if you're keen, or if you're wondering, okay, at what age you may want to start considering getting a check. Okay, so in most guidelines, the general recommendation is actually to start thinking about talking to your doctor from the age of 50. But if you have a family history of prostate cancer, okay, so the guidelines will recommend starting from about 45 years old. This is in general regards to screening specifically for prostate cancer. But of course, if you have urinary symptoms per se, urinary symptoms, okay, so one of the things that we actually will need to rule out, other than checking for prostate enlargement, is whether there's concomitant prostate cancer, for instance. Okay. Why do we say it's important to pick it up early, even if you have no symptoms when you reach a certain age? You should do a check. Is okay. This it put things in a very stark perspective, right? Okay, you can see that if you're picking up cancer, prostate cancer especially, at an early stage, whereby it is in stage 1, localized to the prostate, it has not extended out of the prostate or even spread, the chances of survival is at 5 years is 93%. But if we are talking about somebody on presentation, okay, the pickup to be at stage 4, where it's spread metastatic, okay, despite everything we do, okay, the best treatment available, the chances of survival at 5 years actually is less than half, okay, right, it's 38%, okay. So a little bit about, if we are to seek medical help or attention, all right, what are the ways, what are options available? Typical insurance, okay, most insurance do have general exclusion clause. So cosmetic procedures of course, sexual dysfunctions, fertility issues, typically all these conditions are not covered by medical insurance, okay? But there are schemes. If you are talking about prostate enlargement, one of the common things we see in urology practice, okay, it is labeled or is considered as a chronic disease by MOH, for which you can use up to about $500 a year. You can tap on your own CPF to help payment for the ongoing treatment if you're on medical treatment, okay? To see a private specialist, okay, so most companies actually have corporate specialist outpatient cover, which you can tap on, okay? If you're admitting to hospital requiring treatment, hospitalization treatment, okay, there are people who actually purchase hospitalization plans separately out of pocket, or if you have some critical illness covers, upon diagnosis of cancer especially, all right, that will pay out, okay? The common things that most of us will have, okay, is paying through a CPF, are things called MediShield Life, okay, which usually is sufficient for coverage for bills during hospitalization, covering for subsidized wards within the public hospital. If you're paid additional to cover buying integrated shield plan, you have a topped up, then that will afford you higher coverage, paying for private wards within the government hospitals, or even the or government hospitals or the private hospitals. Okay, so those are the options that are available. If you're unsure, what you can do is before embarking on any treatment, have a discussion with your treating physicians. They have a better idea, actually. I'll advise you appropriately. Okay, so the take-home message, okay, what do we go through? Okay, we talk about what the urology field is, what are urology conditions that a urologist commonly see. Okay, be it cancer, be it stones, or urinary conditions, or infections, or incontinence. Okay, what a common men's health condition that you see a urologist for as well. Sexual dysfunction, fertility issues, or prostate issues. Okay, we went into prostate condition, one of the more common conditions that the urologist sees in their practice, be it prostate enlargement, BPE, or prostate cancer. Okay, what the take home and what is the important message I hope that I'm sharing with you is that, you know, a lot of times, even though not just, okay, it's not just the importance of actually seeing a doctor when you actually have urinary symptoms or conditions. Be aware that, you know, a lot of conditions like cancers, for say, okay, it's important to actually consider doing early checks so that, you know, you can pick it up early, is a better chance of cure.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.